Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation wherever I can find them, including in this conference room with this great startup health background. I found Glen Tullman. Glen, what's up?
Well, it's great to be here, and I didn't expect to be doing this interview right now either.
No, neither did I. And so it's great that we get to catch up. I'm so happy to have you stop by. So we're here at ViVE, everybody, and I'm checking in with Glen. I want to get the latest on what's going on with Transcarent. But I really want to start out the conversation with you about Civica and what's going on with insulin. And so you have invested millions of your own funds through your foundation into a partnership with Civica to produce and distribute insulin at cost. So tell me all about that. That is super exciting.
Well, it really is super exciting. So you know that I've had a long-term commitment to diabetes. And it really started when my youngest son, Sam, was diagnosed when he was 8 years old with type 1 diabetes. And fortunately, he's now 27. He's doing great, but we haven't solved the problem yet. And 10 years ago, we undertook step one, and that was, Sam, if you have diabetes, you have to prick your finger. And he had done that 56,000 times.
Oh, gosh.
So, you know, you can imagine it's like torture and your fingers get calloused. And so we said, what's the solution for that? We launched an initiative on continuous glucose monitors. Today, fortunately, we have those, Abbott, Dexcom, you know, great CGMs that everybody's wearing. So that was number one. Number two was, how do we make insulin affordable for everyone? Because I don't know if you know this statistic, and it's really not a great one, and that is for the last 10 years, insulin costs have gone up 11% a year for 10 years in a row.
11% every year?
Every year,
wow.
With no new increase in research or discoveries. This insulin was discovered in 1922, and the patent was given by the two folks who discovered it for $1 to make sure this didn't happen. Today, insulin's unaffordable for a lot of people in this country, and partnering with Civica, they're making it affordable, driving down the cost something like 70%, which is amazing. And the cost of insulin will now be equivalent to what we have for copays. So $30, they publish the number or less. And that's just amazing. It's going to change everything.
That's fantastic.
And then we have to find a cure. That's the last piece.
I mean, amazing. Well, congratulations on
that.
I mean, truly, that is really remarkable. And I know how passionate you are about that space because you're with your son. So that is a huge accomplishment.
Great. Thank
you.
You.
So I want to also hear what's going on with Transcarent. So give us an update there. I mean, this is fun. I feel like we're getting this impromptu little chat with you. So give us the update on Transcarent. I understand you guys have signed Rush Medical. They're providing Transcarent to all of their employees. So getting some traction with clients. I feel like there's been a lot of chatter about who you guys are working with and, you know, what client base you're building. So tell me about the Rush deal.
So there's a few things. So number one, let's start off with what Transcarent is. So the idea behind Transcarent was, how do we create an experience that's something it has to be new, it has to be better, but it also has to be different, because, you know, for years what we've been doing isn't working. So the basic system wasn't working. Then we created a whole nother industry of navigators. That didn't work. And we've had navigators for years. Did healthcare improve?
No.
Did we solve the problem? No. And so we had to create something that was completely different. That's Transcarent. So what do we actually do? One, we're creating this new, different, and better experience that puts people back in charge of their care. Really, really critical. And as a part of putting people back in charge of their care, we give them on their phone an app that allows them to take care of essentially every healthcare problem they have. So first and foremost, everyday care. And that is, I want to talk to a doctor, and in 60 seconds, 24 hours a day, I touch my phone. There's no billing, there's no who are you, it's all there. You look at your phone and you're talking to a doctor. I want to schedule an appointment with my local health system. Boom, you're on, you can do that. So that's everyday care, and there's a lot more packed in there. Second, prescriptions. We all pay too much for prescriptions. We do an analysis of every medication that you're on, and then based on that, we give you back suggestions of, we could deliver this med to your house at lower cost or no copay or whatever it might be, and who wouldn't want that? And we're doing that in partnership with Walmart. We can talk about that later, because they have everyday low prices. They say it, but it's real. Lower cost. So everyday care, prescriptions. The third one is, if you do need surgery, first we want to get you a free, no-cost second opinion to make sure you need it. And then if you need it, we want to get you to a top quartile facility and doctor. You need both, because if you just have a great doctor and they're operating in a facility that has 2 times the infection rate, that's a problem.
Absolutely.
And so we get you good doctors. 2 other elements of these 5 prongs, if you will. And one is we're moving more and more care that happens in the hospital home. So we'll give you an example. Infusion care, 80% of infusion care is done at home in the rest of the world. We do 80% in the hospital. And it's all because of hospital facility fees. So we're going to make it easier, more convenient, safer, have it done at home. And it's funny, when we surveyed people, 90% said, I'd like to do that at home. And then, interestingly, and here's what's funny, they said, but I couldn't afford it. And we go back and say, well, not only can you do it, it's 30% less.
Wow.
So that's great. And then last but not least, if you're unfortunate, you're dealing with a complex medical issue like cancer, we have a team that focuses on that to make sure you're getting the latest, best, most cost-effective treatment. And so all of that's wrapped together. It's great for employers because they say we have a one-stop shop. They used to think they got that when they contracted with a payer. That didn't work. Then they went to navigators. That didn't work. And now we come along and there's great interest. And you mentioned Rush. It's not only their employees, it's all their dependents. So it's about 20,000. You also know that when we did our offering, other health systems joined in. Like, Northwell in New York, like Intermountain, great health systems that said, we need a new and different payment model. And that's what they get from us.
That's awesome.
Long answer. Sorry.
No, it's a great answer. I like when you get passionate about this, and I think it's helpful to hear you walk through the 5 different aspects of what Transcarent is, because I feel like I get asked what Transcarent, like you've talked to Glenn, like what is it? And it's a little bit difficult to explain because it's not only are you reinventing the care experience, but you're also reinventing the payment model. And we were talking before this interview about, key takeaways from here at ViVE, and we were both on the same page about payment model innovation. And I think it's remarkable to me the amount of conversation that we're having about changing the way that payments for healthcare are done. And so talk to me about what you guys are doing at Transcarent as far as that goes. I mean, taking that control, like you say, you put the patient in charge. I mean, you're also putting the employer in charge in terms of the cost. So say a little bit more about that.
Well, first of all, when all of us are paying something on the order of 40% of the entire healthcare cost, and when you look at that, who else is paying it? Well, our employers are paying it. So, and both of us have been ignored in terms of a better experience. So now we look at that and we say, how do we change that? Well, one, if we put you in charge of that and we're focused on your employer and what they're paying, we can actually create new systems. And you're right, at ViVE, I think a few things. One, payment model reform was one. I think rural care and inner city care, that's Medicare and Medicaid. You saw the launch of Dr. Jennifer Schneider's new company, Homeward.
Yeah,
and,
what do you think about that?
I think it's
old
awesome.
buddy.
I think
What
it's
do you
awesome.
think?
Look, I'm incredibly proud of all of the CEOs. We had Naomi Allen with Brightline. These are folks who worked with us. We hope they learned either what to do or what not to do, one or the other. And so, but those are all exciting areas. I think my message to the entire ViVE audience was talking about it as one thing, but we've got to actually start doing things.
Stuff.
And that's where Transcarent comes in, because we've created a model where we work with health systems, we create bundles, we pay them directly in advance. Nobody else in the world is doing that.
That's awesome.
And no payer wants to do that. They don't even like that we're doing that because they're saying you're going to spoil them. No, if you're going and you're getting heart surgery or knee surgery, you want your surgeon happy. You want your health system happy. We pay them in advance. We don't fight with them. We don't string them out for payments, all the things. And because of that, they treat our people really well, and we get incredibly great pricing. And so that's what we want. And by the way, it's not the lowest pricing. That's not what it's about. It's the highest quality. And that's what all of us want. Can you imagine if somebody in your family needed surgery? Would you say, I'll find you the lowest cost place? No, you'd say, I'll find you the highest quality place.
Absolutely.
And that's what we're focused on. And if we do that, we think we can transform and actually re-architect the entire system.
On this payment model thing, I'd love to just pick your brain real quick on this, because I feel like 3 years ago, nobody was talking about this. It was like the payment model is the payment model. You can't change the payment model. And now all of a sudden it's like the conversation is like, we have to change the payment model, and we are changing the payment model. So what do you think has changed, like the macro trend in this healthcare environment that has made it possible for like a company like yours to even just be like, you know what, we're paying this right away in advance. Like that was never even possible. That was never even part of the conversation before. What changed?
Well, first of all, I think part of if there's any lasting benefit of COVID, it's the fact that it showed how quickly we can change if we need to, if we're really forced to. So we flipped the whole country to digital care basically overnight. Now we're settling in. You know, it started at 3 to 5% for telehealth. We went to 100% when COVID hit, and now we're settling in at somewhere between 30 to 50%. That's 10x in a year. And we've never seen that. And so I think that enabled people. We also saw other things like mental health. More and more people said, I'd rather actually be on a computer and maybe be texting than see somebody, meet somebody. It's less comfortable to talk about mental health challenges. And last but not least, I think these startups, whether they be inner city or rural health, you know, part of how do you get a specialist to the middle of Kansas? Or the middle of Minnesota, to Winona, Minnesota. How do you get a specialist there? Well, you get them on this kind of format. And that way you can know exactly what you're dealing with. So I think digital has an important role in pushing this innovation. And as for the payment models, you know, remember, we aren't there yet. We're still fighting the fight, but people are finally saying, we have to do it differently. Employers saying, we can't pay more. We just can't go another year. And they went 20 years with payers, no improvement. They went 5 years, last 5 years with navigators. Hey, we're going to help you navigate this broken system. That didn't deliver any cost savings. No. It didn't deliver better quality, and people aren't any happier. So did navigators work? I don't think so. No. So now we've got to try something different, which is going at the heart of the system and saying we've got to do everything different. And that's what we're doing at Transcarent.
So you were just on stage with Unity Stokes, fireside chat. And one of the things I heard you say that I thought was really interesting was you were, yeah, I know, right? Actually, I listened. You got one. You got one. It was, you were talking about how everybody's worried about, you know, or talking about, you know, big tech coming into healthcare. And you're like, it's not big tech that we need to be focused on. It's big customer. Yeah. And I'm curious about that because I always feel like the customer, the patient is so disintermediated in healthcare. How like, do you really, like, what do you see as like big customer moving in? How are you feeling that in terms of like removing that disintermediation where it's like, yeah, people are, healthcare companies, hospital systems, pharma companies, whatever it is, they are actually listening to customers these days. How are you seeing that manifest?
Well, I think there's a few ways. One, so we've seen big customer enter, and that's Walmart and that's Amazon. Walmart deals with 200 million people a week who either go to their stores or go to their websites. So from that perspective, they know how to deal with customers. They know how to make them happy. It's not a narrow network. Nobody forces you to go to Walmart. So from that standpoint, they figured that out. Imagine now going to Walmart and saying, I can pick up my medications. Imagine saying I can go there and get, you know, dental services or other medical services. You're already there. And one thing I love about Walmart is it's middle America. So we don't need another company that does concierge care for rich, you know, yuppies. I mean, we just don't. And by the way, that's nothing against those companies. It's wonderful, but we don't need another one. Right. We need to solve the healthcare problem for middle America. And that's what Walmart's going after. What they've done very smartly is they brought on Cheryl Pegas to lead this effort. She knows the healthcare system. Absolutely. So now you combine consumer and healthcare, and that's what we think is going to be magical. Amazon is also going to be a big player there. It's important, but what Amazon's missing is you do need in healthcare actual physical sites. Yeah. Not for everything, but it's got to be a blend. And so they've got to figure that out. I hope, just as we have, they embrace our health systems because that's where the care is delivered. Yep. We have some great healthcare systems that are focused on quality. And my message is we ought to be embracing them, not trying to figure out how low can we get them to charge or turning them into commodities. You know, I want to embrace these incredible physicians and nurses and caregivers that we have that got us through COVID, and that's a big part of our message.
All right, last thing, what's next? What's next for Transcarent? What's going on?
This is it. This is Transcarent. If we can just fix our healthcare system, I'll be very happy for a little while.
Why don't you pick like a bigger thing to go after?
For a little while.
Yeah, just for a little while. Like
we
one day is going to sit there and be like, you know what, it did well.
We have a lot of problems, but the healthcare system, if we can get that done, maybe then education.
Okay. All right. Put it on the list, Glenn. Can you get going on that? Get going. All right. Well, yeah. I mean, congratulations on the insulin thing again. It's
Thank
a
you.
good way to get
And just to be
there.
clear, look, this was the effort of so many people.
I'm sure.
And the effort of Civica. They led this effort. I was fortunate to be one of the people pushing, one of the people to help fund this, and one of the people driving it forward to say, we really can do this because we're taking on some very big multinationals who make billions, not millions, billions of dollars of profit. And, their time has come and everybody should get insulin.
That's awesome.
What it
I mean,
comes
yeah, you're part of a great team and it's a great win for you guys. And it's like, I hear you say, we're going to fix healthcare. And I'm like, okay, track record looking pretty good here. So
we hope so.
Go get them.
Thanks.
All right, Glenn, thanks so much for joining me. I'm Jessica DeMassa, and for more interviews with the who's who of healthcare as they are changing the way that we experience health and care, right? Is that right? Experience the way health and care. Check out my YouTube channel over there at youtube.com/WTF Health. Glen Tullman, pleasure to talk to you always. Thank you for chatting with me in this very impromptu setting. I really appreciate it.
Thank you.
Thank you.
It's been great.
Bye.